Hey guys, welcome back to another episode of Tattoos and Telemedicine. So we have the lovely Miss Nicole Baldwin, and I'm Kelly White. We're going to chat with you guys for just a little bit, and you'll have to excuse my cough because life is happening right now. But anyway, we're going to chat for a little while about some do's and don'ts, some things that you can expect in telemedicine, and just kind of how to set yourself up for a successful visit with your telehealth provider. There's lots of things I think that often goes unrealized in the world of telemedicine from a patient standpoint. It's still a new and upcoming thing for some people, and they just don't know what to do. So, Nicole, what do you think about things that you wish your patients knew before they came to see you?
Sure. So before I jump into that, I just want to say that this is not medical advice. This is not to be construed as medical advice, and this does not constitute a patient-provider relationship. That is, our lawyer makes us say that. So there you go. But to jump right in, I wish patients knew a couple of things. I wish patients that have never done it really realize how easy it is to do it, because it's like the cutest thing when I see somebody and they're like, oh my gosh, this is the coolest thing. I've never done this. Like they just think it's like the coolest thing. And it is, because now you don't have to go wait for an appointment, then go to the doctor, then wait there. I wish that patients knew who haven't tried it how simple it can be. Of course, there's tons of practices out there and tons of options out there, but I really want patients to know to do your homework, to make sure that you're seeing someone or a group that you're comfortable with, that you can trust, that is reputable, because that's just super important. That's super important. First, do no harm. But in every single field, there's always some people that, I don't know how to say it, like they don't have the best intentions or whatever. And you really want a group that is concerned about your health and who really wants to make you the priority over the dollar, because there's crazy stuff out there in the world. And so you really just want to make sure that you have that connection with your provider. But I also wish that they knew, please fill out your intake forms
Completely.
completely. Yes. You want to run with that? You want to run with that?
I mean, completely and honestly, those are so important. I'm going to back up to touch on what you started out with, Nicole. I think that it's so important. There's so many providers out there and so many companies out there that they want to jump on the latest fad, right? That telemedicine's a fad, and this part of telemedicine's a fad. First, it was like, ED medicine and things like that was a fad, and then weight loss medications were a fad, and
Yeah.
they were rolling patients through like cattle calls, like really. And it was, how many patients can you see? How fast can you see? How much medicine can you give? And I mean, it wasn't safe. Patients were not being vetted well. Providers were not being vetted well. We weren't really paying attention to their past medical history, their medications. Is this safe for them? Have they had the appropriate clearances? And so that's what Nicole is saying. Whenever we ask you, make sure that your company is reputable. And if you feel like this is a cattle call and you're just being rushed through, maybe there's a reason for that. You have the right as a patient to ask those questions, and you have a right to step back and say, do I feel like I'm getting adequate one-on-one care with my provider? Because you should be. So having said that, that takes me to making sure that you fill out your intake adequately and thoroughly. So we're going to save you a ton of time by going to a waiting room and sitting and waiting. But unfortunately, there are some things that do take time, and that is filling out that general intake. I have a very lengthy intake for certain things. Acute care intakes are not quite as long, but there are some things that we still have to know. We need to know your entire past medical history. It is crucial. It is critical. It is very, very important. Even the tiniest little detail. If you're coming to see us for an upper respiratory infection and you just were diagnosed last month with an upper respiratory infection and you took antibiotic A, we got to know that, because if this is recurrent,
We're going to
and
send you B.
we're gonna send you B, or we got to know that maybe it's resistant to this, and or maybe it's recurrent and so it's complicated, and that changes our treatment plan. So those things are really important. Also, listing all of the medications you take, all of them, even medications that you take over the counter. Nicole, I don't know about you, but I have to really stress and hit home with patients, over the counter medications count.
Yeah, just because they're over the counter doesn't mean that they aren't contraindicated with other medications. So yes, please do that.
There are certain supplements that cause your blood to thin. So if
Mhm.
we're talking about certain things and you're on a medication that thins your blood and you don't know it, and I give you a prescription that could interact with that, it could be harmful. So those are important. And then your allergies, your list of allergies, please don't forget to put that on there. A lot of patients I see are in their 40s, 50s, 60s and go, oh, I'm healthy, I don't take anything. And turns out they're like, oh, well, I have high blood pressure, but I take a pill for that. Oh, I have high cholesterol, but I take a pill for that. Well, that's important.
Yeah. You ever
Listening to
say this is what I see. Past medical history, none. Medications, metoprolol,
metformin, lisinopril.
atorvastatin, like all these meds. I'm like, what? Like, no. And of course I figure it out. And some patients, they don't know what they take a pill for because the doctor says, hey, take this, and they take it. And that's okay. If you don't know, we'll figure it out. I know if you're on atorvastatin, it's for cholesterol. Like, I will figure it out. But if put it
Let
on
us
there. But your medication list is super, 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 super important, just to make sure that we're not putting two things together that shouldn't be put together.
And like Nicole likes to say, we don't know what we don't know. So just assume that we're a blank slate and you're a blank slate to us. So if we ask you a question, we're not being condescending. We just simply don't know. If you're a female and you're under the age of 50, I'm going to assume you're still having periods. Unless you tell me otherwise, I'm going to ask you when your last period was. If you didn't give me a surgical history, that included a hysterectomy.
Yeah,
So
for sure.
don't be offended when I ask you. And so there's just some general things, when it
Yep.
comes to that. Past medical history is a big thing when it comes to being set up for success. Nicole, will you let us know what are some things that they can do from a tech standpoint that gets them set up for success for their visit?
Sure. So always make sure your microphone and your camera is in use. If you're using your phone, it typically asks you when you go to access it, can we have access to your microphone and your camera? Of course, that's necessary. The other thing is you want to make sure from a tech standpoint that you have decent Wi-Fi. I don't want to miss things that you're saying, and I don't want you to miss things that I'm saying. So a really good signal at the time is fine. Sometimes patients, if they live in the boondocks, they have to drive to the nearest whatever to get on their Wi-Fi or whatever. And I'm okay, not while you're driving, but if you have to go somewhere and you're in your car because you want to be private, that's fine. But just make sure you have that really good connection. It's just going to make this quicker. And so that's, really, really important, is going to be that connection.
And also, talking about connection, make sure that your Wi-Fi connection is private. We do everything we can on our side, and we're going to go into HIPAA and compliance with telemedicine in another episode, but we're going to do everything we can on our side to make sure that your appointment is HIPAA compliant and secure. But
Yep.
if you are not on a private, secure Wi-Fi setting or Wi-Fi network, then you can't guarantee that your information is secure. So going to public places and accessing their public network might not be the most intelligent idea for a telemedicine appointment. So, don't go to Starbucks and access their network when you're trying to have a telemedicine appointment. That might not be the smartest thing to do.
Yep. So you might just have to go where you have a signal. But yeah, so those are great things. Just make sure we have all the information. We're going to have everything compliant on our end, even if it's chatting, if it's video or whatever, because it's just required by law for us to make sure that you're protected from our end. So just protect yourself on your end. As we grow this field of telehealth, telemedicine, it is important to know that if there's an emergency or you need care in a hot minute, you definitely want to go to the emergency room, see in-person care. Telemedicine is not the place for that. The common cold or some medical questions or need labs ordered or whatever, you stayed home from work because you're sick and you need a note or whatever the case may be. Those things are simple. Refills are simple. But anytime someone really needs to lay an instrument on you, whether it's an ultrasound, a stethoscope, or whatever, that's really for in person. But there is so many things nowadays, even for sleep apnea. Now you don't even have to go into an office, be wired for sound, sleep in a strange room with strange people staring at you in a bed that's not comfortable. Now you can do it from home. And the virtual mask fitting is more precise than in person. So it really is getting to be really, really fancy.
Yeah.
So I would say the majority of things I can see you on telehealth for. I can't do a pap smear, right? I can't, listen to your lungs, but I can tell if you're short of breath, if you're tachypneic, if you're breathing heavy, if you're having conversational shortness of breath. I can tell those things. So I may send you to the local urgent care or emergency room. But if you're really that sick, you really should not wait for telehealth. You definitely want to go in and be seen. But we can do so many things. I just wish, patients knew that there's so much to offer, so much to offer.
Yeah, exactly. I think that telemedicine continues to be something that is always changing and always growing. I know that there are a lot of practices now that are even using nonagon devices where they can actually send a device to their patients that are their established patients. And it's a little device that will listen to your heart and lungs for you and transmit those sounds back to your provider. So it's up and coming. And the technology is there, being able to use those are there.
Yeah.
Um, it really is fancy. So for those of us like me in my functional medicine practice, if I have a patient that's going to establish with me and be a long-term patient, having one of those devices in their home could be beneficial, especially if we decide that it's someone with complications and I may end up wanting to hear their heart and lungs at some point. One of those devices could come in handy. So there's a lot to telemedicine and the technology. I think we've covered a lot of great topics today, Nicole. We talked about having good Wi-Fi, having good access to internet, filling out your intakes completely and appropriately, making sure that all of the information is on there, understanding that there are limitations when it comes to what we can and can't see you for. If it's urgent, we're going to let you know that. Anything else that you can think of that maybe we have forgotten?
Just be mindful that you want to select somebody or a group that is someone you can trust, someone that you've done your homework on, and whether it's me, Kelly, or whoever. For me, I do more of like an urgent care, weight management, refills. I do kind of like a catch-all type of thing. And you can find me at hamiltontelehealth.com. Kelly, she does amazing functional medicine, and I'll let her touch on that real quick and how to find her.
Yeah, so I do mostly functional medicine, which just means that whenever you kind of get outside the world of being able to figure out what's going on and you're just kind of tired of the rigmarole of medicine, I'm going to dig down really deep and figure out if there's an underlying root cause to your issue. We're going to dive down to some of the basic causes, whether that's gut health, whether that's metabolic health, whether that's an adrenal cortisol problem. And we're going to touch on those things. We're going to spend a whole lot of time talking about your nutritional status, what your food is like, your sleep patterns, all the things. I could sit here and go on forever because I'm a nerd like that. So I do all of those things. You can find me at karihealth.com. And if you guys need absolutely anything, Nicole and I are always here for you. We bounce ideas off of each other all the time. So please reach out, let us know. We'll have links to both of our websites on our podcast, and we can't wait to see you guys next time.
All right. You guys have a great day.
Take care.